Wait, you're on.
Hello, my name is Jordan Corley,
I'm Evan Milani.
And I'm Zalak Patel.
and today we'll be talking about the topic of physician-assisted suicide.
Physician-assisted suicide, abbreviated as PAS, is the practice of a physician providing a prescription for life-ending drugs to a competent terminally ill patient in order to fulfill a request to end their suffering and their life.
Brittany Maynard was only 29 years old when she was diagnosed with brain cancer. After numerous surgeries, her cancer had become more hostile. She was given a prognosis of just 6 months to live, and rather than living out her days in debilitating sickness, Maynard took her own life through Oregon's Death with Dignity Act. Her advocacy of physician-assisted suicide has sparked intense debate regarding whether the practice should be legalized across the United States. Today, we will be examining this complex issue through an ethical, religious, and legal lens.
Now, in Oregon, the state whose law commonly serves as the legislation for other states' laws regarding death with dignity, there's a strict procedure that a patient must go through in order to receive a lethal prescription. First, the patient must be diagnosed with an incurable disease with a prognosis of 6 months left to live. Then they must vocalize to or request and pen a written request for the drug. After this, a physician must determine the patient to be psychologically competent and then inform them of alternative treatments before filling their prescription.
The act of taking another life brings about ethical concerns, such as whether or not doctors' morals will be corrupted by the practice, or whether or not it is just to dictate how another person will die. There's also concern that the practice violates the Hippocratic Oath, the first tenet of which states, "Do no harm." But as revealed by Dr. Lowe, physician-assisted suicide relieves suffering patients from significant pain and is thus consistent with good end-of-life care.
Diagnosed with brainstem cancer, Dr. Donald Lowe stated that even with palliative care aimed at minimizing his pain, his death would still be a very painful process, stripping him of even the most basic body operations like breathing and swallowing.
Now, many other patients face a similar fate as Dr. Lowe. They could be bedridden with living a life of either pain or stupor. In the face of this type of a death, many patients desire to end their own life in a quick and painless manner in order to retain their dignity and avoid unnecessary pain and suffering. A physician fulfilling this wish isn't being a healer in the traditional sense, but they are healing the patient in the sense that they're taking away certain future pain.
Religious perspectives of PAS consider the matter in broader terms of life and death. Pew Research released an article stating that among the clergy, ethicists, official church statements, and/or other representatives of churches, most major religions in the United States have been found to oppose PAS. They reason that life is an incredible sacred gift that should not be squandered.
While some religions argue that life sanctity comes from God, a claim that cannot be argued in the scope of this presentation, others believe that it is sacred by its nature. In these cases, it could be argued that the debilitating symptoms of a terminal illness degrade from the value of life to the point that it would be better to end it than force someone to live through this debilitating pain.
From a legal perspective, it is necessary to discuss whether or not physician-assisted suicide should be legalized to better regulate the practice and to protect personal rights.
With or without regulation, physician-assisted suicide is happening in America. 3.3% of physicians have admitted to providing a patient with a lethal concoction of drugs, while another 4.7% have administered a lethal injection. But it's been also has been evidence that many of these attempts to take the patient's life don't go very well. These botched attempts often result in the physician having to go to alternative methods to hasten the patient's death, ranging from strangulation to injections of air to smothering the patient with a pillow.
Now, thus as evidence, unregulated physician-assisted deaths can be barbaric and unethical. Even in the worst scenarios involving regulated PAS, in which patients took a longer time to die than expected, the attending physician did not degrade to strangulation to kill the patient. By legalizing physician-assisted suicide, botched attempts would be eliminated by strictly regulated processes.
The fight for individual choices and rights poses a strong argument for physician-assisted suicide in the realm of legality. Advocates of these rights state that decisions a person makes regarding morality, religion, procreation, and death are intensively personal and thus should not be dictated by the government or by the status quo.
Given the ethical and legal needs to provide a consenting patient with the right to a painless death, it is posed that PAS be legalized across the United States. As the Supreme Court has previously ruled that it would not consider amending the Constitution with the right to PAS, such an effort would have to be done state by state. The decision is made in spite of religious opposition, with the consideration that physician-assisted suicide will never be pushed upon a patient who does not desire it. As evidenced by a report in the Northwestern United States, the process will be able to provide numerous individuals with the right to a peaceful and painless death. Thank you.
All right, let's start with Jordan. How did you handle, is that the question I wanted to ask you? No, that is not. What information did you need that you had a hard time locating, and tell me about how did you go about trying to get around that?
Well, originally, I was taking, instead of the religious lens, I was going to go with the futuristic lens, and so while I was looking into that, I found that a lot of people weren't arguing that PAS shouldn't be used because, like, nobody was saying that you shouldn't do this because it'd be traumatic for the patient's families. And so as a result of that, I kind of had to shift my argument a bit, and so because I couldn't find articles that would support that line of reasoning.
Okay. Zalek, what did you decide to leave out of your presentation that was originally in it or that was in your paper, and why did you make that decision?
I think we decided to leave out some of the refutatios because we figured that the main need of the material and what physician-assisted suicide would be a lot more important. And also, we had a few things involving Jordan's futuristic lens in the paper, regardless of the fact that we weren't exactly doing a futuristic lens. We thought it would be beneficial to have some extra information in there to further bolster our point. So we decided to leave that out and just have 3 more main points to keep it simple and effective.
Okay. Evan, if you had more time, what additional research would you do on the topic of physician-assisted suicide?
Well, I definitely would have looked into a lot of the more, probably maybe a first-hand account would have been great, obviously, but and we had a lot of examples of people who had it, obviously, but a lot of everything that was happening is happening right now. This is a really current topic, and it was really kind of difficult to find, because every day a new story or something would pop up, and it was hard to incorporate all that new coming information into our presentation. I think that would have been nice if we could have had some more time. We could have looked into those and had more stuff in the presentation.
Very nice job. Everyone give them a round of applause.